Imagine waking up one day and not recognizing the people you love the most. You look at your son, but he feels like a stranger. You look at your own home, but it doesn't feel familiar. You forget where you are. You forget what year it is. Eventually, you may even forget who you are. This is not a movie story. This is Alzheimer's disease, a silent brain disorder that slowly steals memory, thinking, personality, and independence. Right now, millions of people around the world are living with dementia, and experts warn that the number will dramatically increase in the coming decades. But here is the shocking truth. Most people ignore the early warning signs. They think memory loss is just normal aging, and by the time the disease is diagnosed, the brain damage may already be severe. So in this video, we will uncover what Alzheimer's disease and dementia really are, the early warning signs that many people ignore, the dangerous symptoms you must never overlook, how doctors diagnose dementia, the latest treatments and medications, and most importantly, how to reduce your risk. Because understanding this disease today might help protect your brain tomorrow. So stay with me until the end. This information might save someone's mind. What is dementia? Before we talk about Alzheimer's disease, we must understand something important. Alzheimer's is not the same as dementia. Dementia is actually a general term. Think of dementia like an umbrella. Under that umbrella are several brain diseases that cause problems with memory, thinking, and behavior. These diseases include Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia, mixed dementia. But among all these types, Alzheimer's disease is the most common cause of dementia. It accounts for the majority of cases worldwide. Dementia happens when brain cells become damaged and can no longer communicate properly. When brain cells die, memory, reasoning, language, and personality begin to change. And over time, everyday tasks become extremely difficult. People with dementia may struggle with remembering recent events, recognizing family members, making decisions, speaking clearly, controlling emotions. Eventually, they may become completely dependent on others for basic activities like eating, dressing, and bathing. What is Alzheimer's disease? Alzheimer's disease is a progressive brain disorder. It slowly destroys memory and thinking skills. Over time, it also affects the ability to perform simple daily tasks. The disease was first described in 1906 by German neurologist Alois Alzheimer after he examined the brain of a woman who had severe memory problems. What he discovered changed neuroscience forever. Inside her brain, he found two abnormal structures, once amyloid plaques. Second, neurofibrillary tangles. These structures disrupt communication between brain cells and eventually cause them to die. As more brain cells die, the brain gradually shrinks. This process particularly affects an important brain region called the hippocampus, which is responsible for forming memories. That's why memory loss is usually the first symptom. Why Alzheimer's disease is so dangerous. The frightening part about Alzheimer's disease is that it begins years before symptoms appear. Research shows that abnormal changes in the brain can begin 10 to 20 years before memory problems start. During this silent stage, amyloid proteins accumulate. Tau proteins form tangles. Neurons begin to die. But the person may feel completely normal. By the time symptoms appear, millions of brain cells may already be lost. This is why early recognition is extremely important. The 3 stages of Alzheimer's disease. Doctors divide Alzheimer's disease into 3 main stages. Stage 1, preclinical Alzheimer's. This stage happens before symptoms appear. The brain is already changing, but the person still functions normally. Advanced tests like brain imaging and biomarkers may detect the disease at this stage. Stage 2, mild cognitive impairment. This stage is like a warning signal. People begin noticing subtle problems such as forgetting conversations, misplacing objects, asking the same questions repeatedly. However, they can still manage daily life independently. This stage is extremely important because treatment may slow disease progression. Stage 3. Alzheimer's dementia. This is the stage most people recognize. Symptoms become obvious: severe memory loss, confusion, language problems, personality changes. Eventually, patients may lose the ability to walk, speak, or swallow. The disease can last 2 to 20 years before death. Early warning signs you should never ignore. Many families miss the early symptoms. They say things like, "Grandpa is just getting old." But some signs should never be ignored. Here are the early warning signs of Alzheimer's disease. 1. Memory loss. This is the most common early symptom. Examples include forgetting recently learned information, repeating questions again and again, forgetting appointments, relying heavily on reminders. Occasional forgetfulness is normal, but frequent memory loss is not. 2. Difficulty solving problems. People may struggle with tasks they once handled easily. For example, managing finances, paying bills, following recipes. Their ability to concentrate decreases. 3. Getting lost in familiar places. Someone may suddenly get lost while driving home, or forget how to reach a place they have visited for years. 4. Difficulty finding words. They may pause frequently during conversation. They might say things like, "Give me that thing," because they cannot remember simple words. 5. Misplacing items. People with Alzheimer's may place objects in strange locations. For example, keys in the refrigerator, phone inside a drawer. Then they may accuse others of stealing them. 6. Personality changes. Some people become anxious, depressed, suspicious, irritable. Mood swings become common. Dangerous symptoms of advanced Alzheimer's. As the disease progresses, symptoms become more severe. These symptoms can be life-threatening. Severe memory loss. Patients may forget the names of family members, their own address, important life events, confusion about time and place. They may not know what year it is, where they are, how they got there. Loss of judgment. They may make unsafe decisions such as giving money to strangers, leaving the stove on, wandering outside alone. Behavioral problems. Advanced Alzheimer's may cause aggression, hallucinations, paranoia, agitation, difficulty walking or swallowing. In late stages, patients may lose mobility, struggle to swallow food, become bedridden. Eventually, complications such as infections or pneumonia may occur. What causes Alzheimer's disease? Scientists still do not know the exact cause, but several factors are believed to contribute. 1. Amyloid plaques. Amyloid is a sticky protein. In Alzheimer's disease, these proteins accumulate between brain cells and form plaques. These plaques interfere with communication between neurons. 2. Tau tangles. Inside neurons, another protein called tau forms twisted fibers. These tangles disrupt the internal structure of nerve cells. Eventually, the neurons die. 3. Age. Age is the biggest risk factor. Most people develop Alzheimer's after age 65. 4. Genetics. Some people inherit genes that increase the risk. Rare genetic mutations can cause early onset Alzheimer's before age 60. Encyclopedia Britannica. 5. Lifestyle factors. Certain health conditions may increase risk. High blood pressure, diabetes, obesity, smoking, lack of exercise. Interestingly, lifestyle habits that improve heart health may also protect the brain. How doctors diagnose Alzheimer's disease. Diagnosing Alzheimer's disease is not simple. Doctors usually combine several tests. Medical history. Doctors ask about memory problems, behavior changes, family history, cognitive tests. These tests evaluate memory, attention, language, problem solving. Common tests include mini mental state examination, Montreal Cognitive Assessment, brain imaging. Doctors may order MRI scans, CT scans, PET scans. These help identify brain shrinkage or amyloid deposits. Blood tests. Blood tests help rule out other causes of memory loss such as thyroid problems, vitamin deficiencies, spinal fluid test. In some cases, doctors analyze cerebrospinal fluid to detect Alzheimer's biomarkers. Current treatments for Alzheimer's disease. Unfortunately, there is currently no cure for Alzheimer's disease. However, treatments can help. Slow symptom progression. Improve quality of life. Support brain function. Treatment usually involves medications plus lifestyle strategies. FDA-approved medications for Alzheimer's disease. Doctors often prescribe medications that affect brain chemicals. These drugs improve communication between brain cells. 1. Cholinesterase inhibitors. These are the most common medications used in early and moderate Alzheimer's. They work by increasing acetylcholine, a chemical important for memory. These medications may improve memory, alertness, communication. However, they do not stop the disease. They only slow symptom progression. 2. Memantine. Memantine is used in moderate to severe Alzheimer's disease. It works by regulating glutamate, another brain chemical involved in learning and memory. Benefits may include improved daily functioning, reduced confusion, better behavior control. Doctors sometimes combine memantine with donepezil. New breakthrough Alzheimer's drugs. In recent years, scientists have developed new treatments targeting the root cause of Alzheimer's. These treatments focus on removing amyloid plaques from the brain. Monoclonal antibody therapies. These are laboratory-designed antibodies that target amyloid protein. These drugs aim to remove toxic amyloid plaques from the brain. Clinical studies suggest they may slow cognitive decline in early Alzheimer's disease. However, they also have risks such as brain swelling, small brain bleeding. Because of this, careful monitoring is required. Non-drug therapies that help Alzheimer's patients. Medication alone is not enough. Many non-drug strategies improve quality of life. Cognitive stimulation therapy. This therapy involves memory exercises, puzzles, discussions, learning activities. It helps keep the brain active. Physical activity. Exercise increases blood flow to the brain. Research suggests that regular physical activity may slow cognitive decline. Isolation can worsen dementia symptoms. Patients benefit from family interaction, group activities, hobbies, sleep improvement. Poor sleep may accelerate brain degeneration. Healthy sleep habits help maintain cognitive function. If you are still watching, you are already doing something powerful. You are educating yourself about brain health, so take a moment to like this video and subscribe. Because awareness about Alzheimer's disease can help families recognize symptoms early, and early action can make a huge difference. Prevention. How to protect your brain from Alzheimer's. Now here comes the question that millions of people ask. Can Alzheimer's disease be prevented? The honest answer is, scientists cannot guarantee prevention, but research shows that many lifestyle habits can significantly reduce risk. In fact, experts estimate that up to 40% of dementia cases may be preventable through lifestyle changes. Let's explore the most powerful brain-protecting habits. Control blood pressure. High blood pressure damages blood vessels in the brain. Over time, it increases the risk of vascular dementia and Alzheimer's disease. Healthy blood pressure levels protect brain circulation. Ways to control blood pressure include reducing salt intake, exercising regularly, maintaining healthy weight, taking prescribed medications. Manage diabetes. High blood sugar damages blood vessels and nerves. People with diabetes have a higher risk of cognitive decline. Controlling blood sugar through diet, medication, exercise may protect brain health. Exercise regularly. Physical activity is one of the most powerful brain protectors. Exercise increases blood flow to the brain. It also stimulates production of brain-derived neurotrophic factor. BDNF helps neurons grow and survive. Experts recommend 150 minutes of moderate exercise per week. Examples include walking, cycling, swimming, dancing. Eat a brain-healthy diet. Diet plays a major role in brain health. One of the most studied diets for dementia prevention is the MIND diet. This diet combines elements of Mediterranean diet, DASH diet. Foods that support brain health include leafy green vegetables, berries, nuts, whole grains, olive oil, fish. Foods to limit include fried foods, sugary drinks, processed snacks. Keep your brain active. The brain is like a muscle. The more you use it, the stronger it stays. Activities that stimulate the brain include reading, puzzles, learning new languages, playing musical instruments. Lifelong learning helps build cognitive reserve, which protects the brain against dementia. Stay socially connected. Social isolation increases dementia risk. Regular interaction with friends and family stimulates brain networks. Activities like group discussions, volunteering, community events can help maintain mental health. Protect your sleep. Sleep is essential for brain repair. During sleep, the brain clears toxic waste including beta-amyloid proteins. Chronic sleep deprivation may increase Alzheimer's risk. Healthy sleep habits include sleeping 7-8 hours per night, avoiding screens before bed, maintaining regular sleep schedules, living with Alzheimer's, patients, caregivers, and hope for the future. How Alzheimer's affects families. Alzheimer's disease does not only affect patients, it affects entire families. Watching a loved one slowly lose memories can be emotionally devastating. Caregivers often experience stress, depression, exhaustion. That is why support systems are extremely important. Caregivers should seek help from family members, support groups, healthcare professionals. Tips for caregivers. Here are important strategies for caregivers. Create a safe environment. Remove hazards such as loose rugs, sharp objects, unlocked doors. Patients may wander or fall easily. Maintain a routine. Consistent routines reduce confusion. Daily schedules should include meals, medication times, sleep routines. Communicate simply. Speak slowly and clearly. Use simple sentences. Give patients time to respond. Be patient. Remember, behavior changes are caused by brain disease, not stubbornness. Future of Alzheimer's research. Scientists around the world are racing to find better treatments. Some promising areas include gene therapy, anti-amyloid drugs, anti-tau therapies, stem cell research, vaccines against Alzheimer's. Advances in early detection may also allow treatment before major brain damage occurs. The future of Alzheimer's research is rapidly evolving. Alzheimer's disease is often called the long goodbye, because slowly, memories fade, names disappear, stories are forgotten. But even when memories are lost, love and compassion remain. And the greatest weapon against this disease is knowledge. The more we understand Alzheimer's, the earlier we can recognize it, the earlier we can act, and the better we can protect our brains. If this video helped you understand Alzheimer's disease, please share it with your friends and family. Someone you love might need this information. And don't forget to subscribe to the channel for more health education videos. Because when people understand disease, they can protect their future.